Welcome to the second season of the WUDC Distinguished Lecture Series. This season revolves around effective altruism, and the episodes are organized in coordination with the Effective Altruism Debate Championship. Today, our speaker is Sella Nevo. Sella leads Google's Floods Forecasting Initiative, which provides early warning in developing countries to more than 240 million people and their governments. He's also the co-founder and the managing director of the Israeli Effective Altruism community. In his free time, he teaches information security and applied ethics at Tel Aviv University. Sella was a Euros ESL champion and best ESL speaker, Worlds ESL champion, Euros DCA, HWS Round Robin champion, Worlds DCA, and was the coach of Tel Aviv University debate team for 7 years. Sella's talk is titled Introduction to Global Health and Development. It will be followed by a short Q&A. I'm Dan Lahar, and I'll host the talk. Notes will be in the channel, and if you'd like the content and want similar one, please subscribe. Sella, the floor is yours.
Thank you, Dan, and hi, everyone. In this talk, I want to discuss why global health and development is a promising cause area to work on, go over some basic principles of effective altruism in this context, and discuss some of the most exciting and promising opportunities within this space. Let's start with what we mean by global health and development and why this cause is so exciting. So I'll start off with health. Every year, hundreds of millions of people are affected by infectious diseases such as malaria, tuberculosis, diarrheal diseases, and neglected tropical diseases, and hundreds of thousands die from them. As opposed to many other causes of suffering in the world, many of these diseases are incredibly cheap to treat, and even cheaper to prevent. Malaria, for example, kills more than 400,000 people a year, despite the fact that it is easily treatable. My grandfather, for example, contracted malaria almost a century ago, and already then he received a simple medication that cleared it up in a couple of weeks. There's another reason why health-related interventions are incredibly cost-effective to work on. Donors will sometimes focus on cases where the recipients will need the donors continuously to keep donating day after day to survive or to continue living a happy life. But what's exciting about health interventions is that they're the exact opposite. Most of the hundreds of millions of people affected by these terrible diseases can, in normal circumstances, take care of themselves. They have skills, jobs, families. Often, they'll continue to lead pretty happy lives for many years if only their life or health wasn't threatened by the disease they're currently affected by. As a result, you can often treat an easily curable disease in an incredibly cheap way, scale this up to many, many people, and provide them each with many years of happy and healthy lives. The case for improving people's economic welfare, for example, through cash transfers, has a lot of common themes with what I've just said about health. Almost 1 billion people currently live on less than $2 a day. Such an income means that a single injury or bad crop or unexpected expense can cause tragedies they don't always bounce back from. Many of these people are stuck in poverty traps, where they or their governments can't afford the tools, education, or infrastructure that would allow them to be more productive, earn more, and drive themselves forward. Often, as we'll see in a moment, we can give them a push that empowers them to get educated, invest in themselves or their children, and over the long run, create an immensely meaningful change in their lives. Now, often when people think about global health and development, they kind of say, okay, let's try and find a way to save as many lives as we can. Sadly, though, technically, if we think of saving lives as taking someone who will die and turning them into someone who won't die, then no one has ever saved a life because everyone dies. This may seem like a trivial point, but in medicine, this is a very important point. Many medications will slightly slow the progression of a disease or even keep people alive a bit more, but also have enormous costs to quality of life. Think, for example, of chemotherapy for a really aggressive type of cancer. As a result, counting every time that you delay a death as saving a life is pretty preposterous. But on the other hand, we never do more than delay someone's death. So we need a slightly more nuanced metric for how much we're helping people when we're trying to improve their health. Arguably, the most common metric used in public health is the QALY, Quality Adjusted Life Years. This is a very simple way to try and quantify how much you help someone throughout their life. QALYs count the number of healthy years of living. QALYs count the number of healthy years of living that you've added. So if you've given a medication that increases life expectancy, let's say from 75, like we're seeing in this rectangle, and increases it up to 80, you've provided someone with 5 QALYs, because these are 5 new years where they will be able to have fully healthy lives. But of course, this is overly simplistic because not everyone who's alive is fully healthy. There are also many other interventions that don't affect whether people live or die, but rather change other aspects. People can be blind or in pain or disabled, which we also care about deeply. So QALYs also take into account what is the quality of life that people have. So for example, let's assume that living a year of life as a blind person is about 80% as valuable as living a life as a fully healthy person. That's quite a claim I've put a number on how valuable it is to be a blind person. We'll come back to that claim. Let's for now ignore that and just assume that this is true. Then if I have a medication that will not extend a person's life at all, but give them the ability to see throughout their life, then this will give them 70 years of about 20% of that value, overall providing them with about 60 QALYs. Now, if we knew the actual value of each health condition, how much do people value, let's say, not being blind versus being blind, or having other types of afflictions, and we knew what are the effects of our interventions, then calculating the value of each intervention according to kind of counting them by QALYs would be simple math. We would sum over the differences over all the years of a person's life and see how much that intervention helped. Now, of course, as I kind of hinted at before, that 0.81 that you see on the screen here is quite a significant value judgment. This is making a broad statement about the value of people's lives and their rights. As such, obviously, there's no perfect way to decide what is the value of a blind person's life. What we do in the quality adjusted life years methodology is we try to make our best estimate. And our best estimate is based on what we hear from hundreds of people in the relevant context and their relative preferences. There are many different ways to do this. One way, for example, is to ask people who have become blind about the following dilemma. Let's imagine that we had a surgery that would return their eyesight, but this is a dangerous surgery and would have a 20% chance of leading to death during the surgery. If this were on the table, would they be interested in such a surgery or not? This is one way out of many to try and weigh different conditions with different quantitative estimates and extract that information from the people who have the most experience with these kinds of conditions. But again, this is one way out of many, and there's a whole field dedicated to this question. The 0.81 number you see here on the screen was estimated in this manner. But again, that doesn't mean it's correct or right in some philosophical sense. Now, QALYs have various positive sides as well as downsides. Its main advantages are, one, it allows us to easily compare a wide range of health interventions. Right? Each person is different and each problem is different, but this is perhaps one of our most efficient ways to try and say something about their prioritization. A second advantage is that when we try to do that estimate, we don't just use our own intuitions and say, oh, I think this sounds terrible, but rather we really take the time to invest in asking those who are actually affected by these conditions and try to incorporate their preferences, information, and views. But there are very important caveats to this method. One is this assumption, this method kind of assumes that everyone's welfare is equal, right? I necessarily count additional welfare to one person the same as another, and I can't in this methodology take into account, for example, questions of equality, questions of people's rights, questions of commitments that I might have to different people. It also doesn't include non-health related considerations. So for example, if someone is sad, or if some treatment causes someone pain that isn't something that we kind of measure in a medical condition, this will often be lost to this metric. There are other metrics, one famous one being subjective well-being, that try to capture a lot more of these different considerations. And then finally, I think a very big source of criticism on QALYs is that it can be seen as discriminatory. And the reason for that is that assuming everyone's welfare is equal is inherently not the same as assuming that everyone's lives are equal, right? If we're saying that a blind person's life is worth 80% as much, then perhaps saving the lives of people who are already blind might be intuited to be less valuable. Why am I bringing up all of these caveats and these advantages? Because we need to understand what we want to use QALYs for. QALYs are useful as a broad metric by which to judge extremely large interventions. For example, I want to know what I want to invest in broadly. One intervention in one country that saves thousands of QALYs, or another that saves tens of thousands. It is not a good metric if we're going to use it either at the individual level. If we're talking to an individual person, we probably want to ask their preferences rather than this average across hundreds of people that we've interviewed. And it also does include baked in a lot of value judgments. So I want to clarify that all of the organizations that I'm going to discuss in this talk don't use QALYs as the only metric for deciding what interventions are more promising. But I am in this talk going to use QALYs as a quick measuring stick just to see what we're talking about. If we see that one intervention is 10% more cost effective when counted in QALYs than another, we should be suspicious. A lot of value judgment went into this measurement, so maybe based on our values, we'd get a different result. But if we see that one intervention is 10,000% more cost effective than another one, then it's likely that even if we estimate the value of different health outcomes differently, it wouldn't change the bottom line. So how do we find effective interventions? A surprisingly important question turns out to be, where are you implementing this intervention? Let's look at some data that will show why this is the case. For example, one of the most highly regarded cost-effective charities in developed countries like the US, the UK, and Netherlands is the Nurse Family Partnership. This is a truly excellent charity that has been and continues to be evaluated by top academic organizations such as JPAL, and continuously receives praise for the effectiveness of its intervention and the great execution of its team. They provide home visits by nurses to women in their first pregnancies that are either poor, teenagers, or don't have family support. And they teach them about health decisions, proper childcare, and more. Their cost per family served, including all the overheads, which is different from what charities usually advertise, is about $15,000 per family. This intervention has been robustly shown to improve children's performance in primary school in math and reading by about 6%. And in 8% of cases, it also prevents a case of neglect or abuse by the parent. That means that we can confidently know that for $187,000, we can prevent a case of abuse, plus slightly improve school performance for about 12 children. Now compare that to the best health charities in developing countries. The Against Malaria Foundation provides free anti-malaria bed nets to people and guides them on how to use them. On average, every $3,000 to $4,000 donated prevent a child from dying of malaria. This is in addition to about 560 additional children that are spared getting malaria, even though it would not have been fatal for them. If we care about children in the United States and, for example, Nigeria equally, which admittedly not everyone does, then with a $187,000 donation, we can either save one child from neglect or abuse, or save the lives of 46 children and prevent 26,000 children from contracting malaria. How are such enormous differences even possible? This isn't because charities in poor countries work harder or necessarily do a better job in some abstract sense. There are truly excellent charities in the United States and other countries, and there's a lot of research invested in finding the best interventions. Now, some might say, well, costs are cheaper in developing countries, which is definitely true, but not on the order of magnitude we're talking about here, not at a 100-to-1 scale in terms of the cost effectiveness of different interventions. The top reason for this enormous difference relates to a famous concept called diminishing marginal returns. We're not the first people to ever want to help. This includes both governments and other donors. The main reason donations are so much more cost effective in developing countries, at least within the health and development space, is because that in rich countries, there's enough money to fund the really extraordinary opportunities to help people already. The UK is a great example because they're far more transparent than most countries. The NHS in the UK is roughly willing to fund medical treatments for its citizens if they cost less than 20 to 30,000 pounds per QALY, or since I've been using dollars before, between $25,000 to $39,000. This means that in general, though not always, if there's an opportunity to improve someone's health at a lower cost than about 20,000 pounds per QALY, someone's already paying for it, which means that in most cases, and especially if you want to contribute at scale to help a lot of people and not in one particular case, you're probably looking at less cost-effective interventions than that threshold. When problems fall between the cracks in governmental bureaucracies, as they often do, there are many charities there to pick up the slack. Overall, British people give about 10.1 billion pounds, or $13 billion, every year to charity. These 10 billion pounds are spent mostly on poor people within Britain. It's about 14 million people. This means there's a lot of people looking for opportunities on who needs help. Now, none of this says that many people in Britain don't have extremely serious problems that are worthy of our help, or that these aren't worthy investments in and of themselves. A person's life is incredibly valuable. And I would say it's worth much more than the 20,000 pounds a year that the NHS might be willing to give. But these existing donations mean that in Britain, you're forced to donate to, I'll say arbitrarily, the 1,000th most effective intervention, because thankfully, the first 900 are already funded. But not everyone is so lucky. Treatments like seasonal malaria chemo prevention, vitamin supplementation, and deworming are estimated to provide a full year of healthy life for every $100 invested. And yet they're still not being funded sufficiently to provide them to all children who need them in Burkina Faso, in Chad, Nigeria, Ghana, Malawi, India, Kenya, and more. Not only are these interventions effective, but not enough people, or at least people who have enough money to give, care enough to want to fund these. So they really do depend on people like yourself helping out. Now, many people feel that they should be giving locally to their community or their country. They might feel that they have an obligation to those closer to them, or even that they just care about their fellow citizens more than they care about other people. Now, people can have whatever set of values that they want, and that's absolutely fine. But what we want to make sure we're doing is asking the right question to which you can answer whatever you want. The concrete, actionable question you need to answer if you want to donate, say arbitrarily, $3,000, is not, do I prefer to help a child in my own country or arbitrarily a Ugandan child? At least if you live in a high-income country with a strong healthcare system by global standards, not by the standards of the newspapers that are publishing articles about your healthcare system in your country. The question is whether you want to help a single child in your country do better in school or deal with small chances of negative health outcomes, or prevent 560 Ugandan children from getting malaria. No matter your normative ethics, what you think is important, what you care about, in reality, this is the decision that you're making. Which one is the right one? I'll leave it for you to decide. Okay, so let's assume that we've decided that we do want to help with global health and development. Are we now supposed to go through all the evaluations of cost effectiveness, identify promising interventions, calculate cost effectiveness, and prioritize between them across all tens of thousands of charities that are begging for our attention? Obviously, the vast majority of us don't have the time to do that, let alone the professional expertise to do the analysis necessary. Luckily, we don't have to. GiveWell is an organization founded to help people exactly with this problem. It was founded originally by two venture capitalists, Holm Karnowski and Eli Hassenfeld, two analysts in a venture capital firm, that wanted to donate some of their earnings. And they were looking for data similar to what they have on all the stocks that they want to invest in. They wanted to see what is the return on different charities that they donate to. They have a lot of charities asking them for money, but what does that money actually do? They were surprised to find that they couldn't get all the data that they needed. There are a lot of charity evaluators, but those charity evaluators mainly look at things like overheads, what percentage of the money goes to the actual cause, rather than effectiveness, whether the money that does go to the cause actually achieves what it aims to achieve. So they decided to take this as a full-time job and founded GiveWell, a charity that evaluates other charities to identify the most promising given recommendation. You'll hear a lot more about GiveWell in the next talk, which will be dedicated exclusively to that topic by Olivia, one of the employees at GiveWell. But I wanted to say a few words about a few of GiveWell's top recommended charities. We've already mentioned the Against Malaria Foundation, which distributes anti-malaria bed nets in areas that are highly affected by malaria. GiveWell estimates that for every $100 donated to them, we provide another full year of life, another QALY, to a child, on average, of course. It is currently estimated by GiveWell to be the most effective charity they've ever evaluated. GiveDirectly is another charity that takes a very different approach. They use what's called unconditional cash transfers, which means they simply send your money to extremely poor farmers in developing countries. The fact that they send cash means, first of all, they have almost no overheads. They don't need to check what people do with this money. They don't need operations in every country that they operate in. And in fact, the whole organization, despite having helped an enormous amount of people, currently has only about 15 employees. But this also means that recipients can use this money however they want. So if different recipients have different problems that need addressing, they can address that funding to what really troubles them most, rather than what is the donor's preconceived notion of what they need. Now, when people hear this, they often find this fact concerning. They're worried that recipients will use this on the wrong things. Maybe they'll buy cigarettes or alcohol or gamble it away or do other things that the donor wouldn't want them to do with the money, and indeed probably wouldn't be very cost effective in improving their lives and their families' lives. But in fact, unconditional cash transfers are the most well-studied economic intervention of all of GiveWell's recommendations and pretty much all interventions in the global health and development space. And consistently across an enormous number of studies, we have seen that the vast majority of funding is spent on education, critical welfare improvements like people fixing their roof, which they couldn't have done before, or tools that enable them to improve their income over the next years. That could be better plowing equipment for farmers, or people who take this money to travel to a location where they can earn more. Overwhelmingly, this money not only provides people with short-term relief, but is also used by the recipients to advance themselves and their children's lives, ending up with them earning more than 10x the amount of money donated to them on their own over the next 10 years. third recommended charity, and the last one that I'll deep dive into, though this isn't the last one that GiveWell recommends, is SCI, and I won't even try to pronounce the full name. SCI has a deworming program. Deworming is a very interesting case for a health intervention. Deworming tries to address a problem of intestinal worms. Intestinal worms are something that people don't love to talk about because they're kind of gross. I don't recommend Googling them. But intestinal worms are very rarely fatal. This intervention isn't aimed at saving lives, but they're extremely unpleasant. But another interesting fact about intestinal worms is that there's a super cheap and effective medication. You can take some pills that have pretty much no side effects and can ensure that you won't get this problem anytime soon. One challenge, though, is that testing whether someone has intestinal worms already is actually more expensive than the treatment itself. So SCI uses an interesting intervention. Instead of testing, it goes to schools in areas where there are a large percentage of the population is affected and just gives this medication to all children. Now, this prevents the direct health harms to the children, but where this intervention really shines is in a surprising direction, and that is improving children's education. In many areas, especially in sub-Saharan Africa, such a large percent of children have this issue that it is preventing a significant portion of their time at school, which leads them to kind of lose where the class is and has longer term effects on their overall education, even 5, 10, 15 years later. There have been some decades-long studies showing that giving these children this medication improves not only school attendance, which is what is easy to measure immediately, but also longer-term performance, and eventually even job opportunities and earning abilities. In fact, this specific intervention, because it's such a cheap medication that can be applied at scale, is so cost-effective that it is the most cost-effective education intervention ever evaluated. Most education interventions focus on getting better teachers, building more schools, giving people books, or other ways that are directly related to the educational system. Here, that's not what we're doing, but still when we measure what are the effects of this intervention, we get that more kids perform better and have more opportunities in life later on than if we spend the same amount of money on any intervention we know of that directly tries to address education. In fact, Michael Kremer, who pioneered these studies, just last year won the Nobel Prize of Economics alongside Estelle Duflo and Abhijit Banerjee for this work alongside other randomized controlled trials to try and answer these exact questions. Now, many of you are probably thinking, I'm a student who doesn't make any money. Why and how could I possibly donate to these causes? And that's a very fair point. Today, while you're students, it is absolutely true that you're likely to have significantly less money than you will have in the future. But you also have one very important advantage, and that is that you're likely more interested in helping others and in these topics in general than you will be in the future. Not many 35-year-olds ask themselves, wait a second, what is the most important thing I can work on, and where should my life go from this direction? So I want to talk about two things that I think are specifically and concretely relevant to you today. The first is an organization called Giving What We Can. Giving What We Can is a student organization that drives a pledge to donate 10% of your income in the future. The idea is to join a community of people who are saying, we recognize that this is important. Probably most of our earnings and most of the donations won't come today, but we kind of want to push ourselves in the direction of saying, we want to help. 10% is kind of an amount where you can say, well, this isn't going to change whether I'm a rich or a poor person, but it is a significant amount that for many people means they can save a life every few years throughout their career, no matter if the career that they've chosen directly health people. But to be honest, the reason I've been talking about donations for so long is not because it's the most important thing, but just because it's simpler and easier to talk about. Your dollar is worth the same no matter where you come from, no matter what your skills are and what your preferences are. The charity you donated to will be able to use it equally well. And so comparing charities is easier. But when we're comparing careers, it's much more difficult. But that's still something worth pursuing, because most people, especially those that are not born very rich, will have the ability to do much more with your career than you can with your donations, at least if you use it properly. I want to discuss a few relevant and promising paths. So the first path, which you've already heard about in one of the previous talks, is charity entrepreneur. Of course, I mentioned charities that already exist and use donations, but GiveWell's list of top charities changes, and it changes because new people found new charities that are even more effective than the ones we already have. So trying to identify the most promising interventions and then bring them about is a really promising path. Second, to be able to find these opportunities, we need to be able to analyze those results. And that is a very, very complicated process. Development economists are people who focus a lot of economic expertise on specifically these kinds of questions. How can we improve both the economic welfare, but also the health and other types of welfare of people in low income and middle income countries? Thirdly, increasingly, this research is bringing in tools from data science. So if you're less in the kind of economics direction, but more quantitatively, but still quantitatively inclined, data scientist is a path that can lead you to be a very valuable asset for many research organizations. And lastly, if finding roles that affect relevant policy, whether that's within the government or from outside through think tanks and consultancy, can be really significant, especially if when you get into these roles, you continue to be committed to high impact, evidence-based interventions, in which case you can try and pull those organizations with enormous resources, like governments, in the right direction. I also wanted to add here a few organizations that I think are particularly promising. So first, of course, the top charities are incredibly valuable organizations, where if you can be better than their top current candidate, you may kind of continue to have to push them further into even larger impact. The top research organizations that really move the needle on understanding what works and what doesn't, and helping move governments towards implementing these organizations are listed here. The Jameel Poverty Action Lab, the Center for Effective Global Action, the IPA, which I forgot the full name, the Evidence for Policy Design Center, GiveWell, which I've mentioned before, and ID Insight are all organizations that really at the global level are driving significant change. And like I mentioned before, directly joining the relevant government agencies that control both the budgets and the policies for interventions that help those who need it most is an incredibly valuable career path. That's it for me. Hope you enjoyed this talk, and see you in the next talk.
Thank you, Sella, for this fascinating lecture. If you can please stop sharing the presentation so that we can see everyone from the audience. Thank you. So shortly, I'll open the floor for Q&A. Before that, I'll ask a few questions that I think are necessary for our audience to get to know you a little bit. So your job is very unusual in a sense. You're working in a for-profit company, but you're doing a job which is for good. You're working in flood forecasting, and to the best of my knowledge, you don't have formal training in being a hydrologist or anything that is water related. So would you mind sharing what are you actually doing there, and how did you even got this opportunity, and what shaped it?
Yeah, so I spent quite a while trying to look for what career I could choose that would have the largest positive impact I could. And as I mentioned, it's very hard to answer that question. I knew that my skills were kind of in the tech space, and I generally believe in technology as a tool to drive impact at a large scale. so I was looking mainly in that space. And so I tried to meet with every tech company, startup, and NGO that I could find to ask what opportunities they have and try to look at what is most promising. So I went also to large commercial companies like Google, Facebook, Amazon, and so on, and asked them if they have any projects that have a significant social impact. And when I arrived at Google, they said I met with someone who said, not really. Well, actually, there's this one project, but I don't think it's relevant. And that answer intrigued me. So I said, okay, I think that's based on what you just said. That sounds like the only part that's relevant. I probably won't join for anything else. So what's that opportunity? And then he said, look, 2-3 years ago, Google's crisis response team did a broad scale evaluation of about 60 different interventions that Google could do and try to estimate what's the life-saving potential that it could have. They called it something like QALYs. And based on that research, the most promising intervention was improving flood forecasting systems. But it's not clear if we're going to open that project, and if so, when. Then I can't accept you for that project at this stage. So I asked him. I've been into effective altruism and QALYs for quite a while at that time. So I asked him to see the actual research, and he was kind enough to share that with me, and I immediately fell in love with this project. I had already a list of my own 50 ideas for social startups I could start, and they were all just complete crap relative to this project. Really, there was no comparison. So I had decided that my goal would now be to convince Google to let me open this project and start working on it. And so that's how I got to where I am today. Nowadays, I lead a team of about 25 people that do several interventions. Floods is the only one that's already launched and is kind of publicly announced, but we have several interventions in the humanitarian and environmental space. And really, we've been lucky enough to receive the mandate and the ability to prioritize on our own what we believe are the most promising interventions, and then get Google level funding to try and implement them. So it's a very, very exciting place to be.
It's very impressive. And these services are provided to over 200 million people in the world, right?
Yeah, specifically more than 200 million people in India and Bangladesh, but hopefully soon the world at large.
So you've said that once, at the point that you've gotten to Google, you were already interested in EA and QALYs and all of the professional terminology. Do you mind sharing how you've gotten into EA in the first place?
Yeah. So so I think my path was a long and winding one. As a kid, I was a very kind of stereotypical geek. I played computer games. I liked math riddles, and there was nothing related to helping others in my personality or my life. And then at the age of 13, I, through some random happenstance, ended up on a volunteering and meeting with a Holocaust survivor, and kind of just spending some time with her. And by the end of that afternoon, which I didn't actually go through my own goodwill, I suddenly realized that I've been alive for 13 years and I've never done anything that mattered to anyone. And today, I did something that mattered to someone. And that was like a very, very strong, left a very strong impression on me. I then spent quite a few years volunteering in a wide range of different organizations, mainly with youth at risk, but not only, and which was an amazing experience. But one of the things that continuously nagged at me is that I felt I might be able to do more. So for example, I would work with a child, let's say in the 5th grade, for 2 years. And sometimes it would help. Sometimes that person, you could see a trajectory going in the right direction. And many times it wouldn't. I would spend many hours a week for years, and it doesn't always help. You can't always do as much as you'd like. And so I increasingly started to ask myself, okay, is this the best thing that I could do? Am I really, really trying to solve these problems as much as I can? And eventually I thought the answer for me at least was no, that in fact, I was utilizing the skills that for me are not my strongest skills. I'm a nerd, but so the direct social skills are not necessarily the way in which I help the most people, but in fact other skills that I have might be able to help at a really large scale.
It's very, it is very interesting, and you do give some tips for people for like general career advice. But I wonder if if someone is currently at university and want to do something similar to what you have done, what would you recommend that that they would use their time, or which skills do you think they should acquire?
Yeah, so I'll give a few maybe pieces of general advice. I think the first thing that's worth considering is that you should be considering a much wider set of options than you are considering already. So most people kind of assume that they should continue on the same path that they have been continuing, and that's when people explore more options, they find much more often than they expected that there's actually better options in terms of everything, not just in terms of helping others, also in terms of their own life satisfaction than they were aware of. The second thing I'd say is to treat the process of finding your career as an iterative experiment process. And I'll explain. Many people are kind of are threatened by the fact that they're told that they need to choose what is the career path for them. And this is a very scary notion, but it's a completely wrong notion. There is no sense in which 2 years later you can't start pivoting towards other directions. And so I think the better way to look at this is to say, well, what's the most cost-effective way I can find out more about the most promising directions that I have in my career, right? And that could be just going for your best bet career and trying it out for 2-3 years, and that's okay. And it's okay if after 2-3 years you say you don't want it. But there might be even more cost-effective ways, even quicker ways to get that information. For example, if you're interested in a profession, take a couple of online courses, right? Do a quick internship. At the very least, talk to people you know, or through people you know, to people in that field, and ask what are the kind of highlights and what are the things that people complain about. These are very, very efficient ways to start disqualifying options and at least get a better sense of where you want to go. And then the third is, I do think it is, if you want to have a significant impact in your life, I think it's important to recognize that and start thinking about it early. Like I said before, it's a complicated question, and trying to optimize for what you feel like doing, but also add a sprinkle of, but this is also for good, is very different from trying to find extremely effective ways to help a lot of people. So if you want that as part of your considerations, it should be, you need to take that into account and actually change the decision-making process you're doing.
Do you think that there is anything that you could have done that would have placed you in even a better position to do good right now? Something that you regret not doing earlier?
So I think one thing that I learned the hard way is that it's really important to be very empirical and test yourself constantly. And I think this is something that debating a bit pushes you in the wrong direction. Debating really, you kind of train in debating for years to say, well, there's evidence and there's data, but here is a really, really impressive narrative for why this is the most important thing we can do. And I've been trained for more than a decade in really telling really compelling narratives. But narratives don't save lives. And narratives, the reality doesn't care that you've gotten really good arguments for why something will work. If you think of a specific intervention or a specific project, it will work or it won't work. It depends on the information on the ground, not on what your pitch deck says. The pitch deck is very effective in changing people's minds on whether they should invest in you. That is very, very effective. But on whether it'll work, it doesn't help at all. And so you really need to, from early stages, start checking and testing what you're actually doing, talking to the people you're actually affecting. And the earlier you do that, the better. Every time we've started testing something, we've realized we've been wasting a lot of time before we've tested.
since you've bashed debating later, I wonder if you think that, and we are targeting for an audience of debaters, I'm wondering if you think that debating was helpful to you in some of your career advancement so far, and if it was, if you can share well and how.
Yeah, so I stand behind my original statement on a specific harm that debate does, but overall, debating has been incredibly important to my ability to make progress at Google and in all of my other endeavors. I think, despite what I think people should do, is kind of be empirical, look at the evidence, and so on. What people actually do is almost overwhelmingly looking at the narrative and how exciting what you're saying sounds. And so the ability to go into a room and on various different topics be pretty effective at convincing people on what the right path is really, I think, perhaps the most valuable tool that I have, much more than my programming skills, even though I work in tech. And has been the reason I've been able to kind of create these kind of new initiatives. In many ways, I see my role at Google as being a person who will look at the evidence, then decide based on the right criteria what is promising, and then use all of the wrong criteria, which is a lot of really impressive persuasiveness, to convince other people at Google to invest in this as much as they actually should.
Do you think that your coaching had anything to help you with your advancement in your career?
Well, first of all, it allowed me to meet the wonderful Dan Lahav, which has been a life-changing experience. So one can never undercount that. So I think in coaching, I often feel like I don't understand things until I teach them. And so that, I think, was very helpful. There's no doubt that my understanding of specifically debating, not even teaching debating, is better today than before I started coaching. So I feel like that's if someone really wants to kind of fully hone their debating experience, I would strongly recommend coaching others.
I'm sure that there are many people out there that appreciate this answer. Also me, because you've mentioned my name, but the general answer. So I can continue this conversation for hours, but I think it's time that we'll get our audience involved, and I'm sure that they have a lot of questions on the lecture itself. So just by show of hands, if people would like to ask a question, I'll moderate. Yes, so Sharmila, go ahead.
So I have a bunch, but I'll start with one that continues Dan's train of questioning, actually. So there's a lot of discussion of comparison and quantification. Now, if someone were more of a qualitative researcher or a philosopher, maybe a lawyer, or someone more partial to ethnographic approaches, what role can they play in this world that you've described? Like, then how can they do good in this framework?
And that's an excellent question and an important question, because I said in a sentence, and this was, I think, too quick, and so I'm very happy that you asked that question, that I said about QALYs, that this is just like one metric and one way to look at this, and it's not the full picture. And I think that this applies in general to quantitative analysis more broadly. So in all of the analysis that I described, the quantitative analysis, which is what I've been focusing on, is really one part of a larger whole. A lot of the questions that we need to ask are questions that we just don't have the data to answer, or that touch on questions that are inherently not quantitative, right? If I want to know, for example, which charity is also a good executioner and is promising in their ability to, in the future, utilize and new funding and other projects, this is not a quantitative question, it's a qualitative question. If I want to understand how to build surveys in a way that will get the information across to the people that I'm asking, and how to interpret the results. If I want to ask how it affects them in things that neither them nor I know how to put into quantitative terms, right? Were they pleased? What would they want us to do, right? These kinds of things are not quantitative. And so qualitative analysis is a major component of all of this analysis. I'll mention, even within the roles that I mentioned, so development economics, think tanks, and so on, there is a lot of more qualitative analysis roles as well.
Thank you for the answer. Let's take another question from the audience. Amira, go ahead.
So I guess my question is, I don't know if it's a niche question, but maybe one that I feel more relevant to like a Malaysian context, because obviously I can only judge by what is my environment. But like, I think taking off what you mentioned in your lecture and also what Sharms said about qualitative, like, how do you think religious or cultural kind of organizations play into this dynamic, in a sense that like here back in Malaysia, I do see a lot of NGOs or kind of like that kind of institutions that are a little bit more religiously or culturally influenced. And even if it's not on the more extreme end, like if they're willing to teach children like basic education, but along with that, there comes a catch-22 of some religious studies. Like, how do you feel like these kinds of NGOs play into the bigger dynamic of effective altruism?
Yeah, so I think undoubtedly the local culture and kind of fitting what you're doing to what people want and what they'll respond to and what they'll corroborate with and what their values are is incredibly important. And I think that the organizations that are recommended by effective altruism do this. So they operate very differently in different countries and they listen to these kinds of considerations. I think that specifically, I think what kind of ties in, I think, both of these questions is that it is important and sometimes difficult, but I think still important to differentiate what are the questions that are best answered objectively and analytically, and what are the questions that are best answered subjectively and in a culturally relevant way. Because, you know, if you have a certain medication, whether that medication works is a question that we can quantify. And it doesn't matter what your culture is; it won't work. Well, there's a slight placebo effect that might slightly change, but for example, how do we now want to implement this? Right? Is this something that people will cooperate with? How do we want to give this? You know, how do we want to interact with them? How do we want to collaborate with them? That is definitely not an objective question. That is a question that heavily depends on the local culture. And mainly, I think the point. I'm not going to dive into, and I'm not the right person to dive into kind of exactly pulling these two and separating them. But I think the important point that I would want to get across is it's important to not just throw away either of these sides out of kind of commitment to the other, right? So sometimes people will say everything needs to be quantitative. And so if you cannot give me statistically significant studies of something, I will not listen to you, which is the wrong way to go. And some people will say, no, look, because things are subjective and culturally dependent, there's no use in ever measuring things, which is also, I think, a bad approach. So I think that's the most important principle, and then implementing that is a whole career's worth of effort.
Thank you for the answer. Let's take another question from the audience. Yeah, Neil, go ahead.
I have a question about GiveDirectly. If I put what you said earlier in the context of like debating, I can't help but feel that giving people like hard cash mean we're losing like a lot of the effective benefits charities have, for example, economy of scale, etc. So, but still you're saying that it's very effective. So how can you compare between the two?
Yeah, so I think, so here again is where I think reality and debate a bit differ, which is, I think, I'll give a few justifications for why that is the case, but I wouldn't know that this reasoning is more important than, for example, the consideration that you mentioned, which is economies of scale, if we hadn't tested it on the ground and saw what the results were. So a few considerations that make this very effective is one, just the fact that, so economies of scale are true, but if you want to do this at huge scales, you do need the infrastructure to deliver it, to distribute it, to check perhaps that people are not then misusing or selling off those items or things that you kind of don't want to do, and various other overheads. So one is you just cut costs in that sense. And the second is simply that, at least GiveDirectly would argue that the importance of letting people prioritize their purchases and optimize them for their needs is just very large, even more than, let's say, the 30% discount that you would get through economies of scale. But again, I wouldn't know this, you know, if tomorrow there come out 20 new randomized controlled trials with larger sample sizes than the ones we've done now, and say the opposite, that conditional catch transfers are more effective, I'd flip this position immediately. So it's not really the consideration. It's mainly that this thing has been thoroughly studied, and at least based on the metrics that we've used, right? You have to talk about, okay, what are we measuring to say how good it is? But these metrics, like income over the next decade or two, like education outcomes, like health outcomes that are measured and so on. In these ones, it seems that unconditional cash transfers beat even the best conditional cash transfers.
Thank you for the answer. Let's take another question from the audience. Dana, go ahead.
As you yourself mentioned, BP debating doesn't give too much credit to statements like research says that X is more effective than Y. Can you give any suggestions on how to analyze, QALYs or EA metrics in debating, especially for the upcoming competition?
Yeah, so that's a good question. So I think first of all, there is, I think, a trick in BP debating that can give some more credence to evidence, and that is if you know enough to kind of prove that you're not lying about it. So right, if you say research shows, that everyone is 100% sure that you're lying. If you say, look, in 2017, the JPAL did in Nigeria this, the results are 1, 2, 3. I have it here with me. Blah blah. Then usually I think judges will listen. Please do not abuse this to say to thoroughly describe studies that do not exist, because then judges will stop listening to that. And I think it's good that judges can sometimes listen to evidence if you really, really know what you're talking about. So that's one trick that I think is useful. But I think there are a few kind of broader principles that can be taken from this. The first is just incorporating cost effectiveness. In reality, what we care about is not effectiveness, but cost effectiveness. We always have a finite amount of resources, whether that's money or time. And so if we have an intervention that is twice as effective as another one, but costs 5 as much, we'll be applying it to 1/5 of the people, at least unless we can kind of take care of all the population, and then that's fine. And realizing that point really changes where the clash is on comparisons between different things. So that's one thing that I would mention in terms of cost effectiveness. A second thing that I would mention, and this is I like to call it the EA extension. There used to be a thing where people would, I don't know if this still happens, but there used to be an argument called starving children in Africa, which would be there would be a proposition, and that proposition would have some costs, and then the opposition would say, let's not do this proposition because it's better to give this money to starving children in Africa. And slowly, judges stopped accepting the starving children in Africa argument because it ruined all debates. So maybe what I'm going towards is not advice for debaters, but rather advice for life, which is, in reality, the fact that judges don't like this argument doesn't matter. Starving children in Africa, well, I think starving children are not specifically the most effective intervention, but people in developing countries who have much more severe needs than the things that we love talking about really are important. It's not fun to debate, but it is fun to help. Do it.
Thank you for this answer. So let's take the next question. Yeah, Shams, go ahead.
Okay. So we spoke about global health. How would you situate mental health in this conversation on global health, and the state of our understanding of it, whether it factors into donor priorities at all? Yeah.
Oh man, these are such good questions. So mental health is an incredibly, incredibly important cause area, and one that we understand much less about. So the main challenge with mental health is that we briefly mentioned how hard it is to measure the value of things with physical health, and mental health just adds another layer of all of our metrics have this kind of ambiguous, it's hard to cross-validate, every person can feel in different ways, which makes it harder to measure, which doesn't mean it's less effective, of course, just makes it more challenging to find out how effective it is. particularly in the last decade, there have been many advances in this direction. So one is there's the metric called, I mentioned it briefly, called subjective well-being, which is slowly gaining traction because we've been able to show that it, let's say, behaves nicely as a metric. It kind of shows the external validity. It kind of produces consistent results, even in different cultures and things like that, which is really great news for being able to trust it. And as a result, we're also starting to get signals that perhaps some of the most effective mental health interventions are perhaps significantly more cost effective if what you care about is subjective well-being, right? If you care about how people feel and not some kind of objective physical description of what their body is like, then they might be significantly more cost effective. There as well, by the way, the most cost-effective interventions right now seem to be kind of large-scale interventions that have to do with depression, anxiety, and other kind of very common diseases in developing countries, because there as well, the tools that people have available to them in developing countries are often just very, very subpar relative to what even poor people in rich countries have. And then the last thing I want to say on that is that specifically, I think it was last year that a new organization called the Happier Lives Institute was founded exactly for this purpose, to try and strongly push forward our understanding of mental health interventions, identify and prioritize the most effective interventions, and then advocate for looking into those. So all of this is to say, I think we're still in pretty early days about those kinds of interventions, but I would bet that 5 years down the line, it'll be pretty consensus that that is one of the most important cause areas.
Thank you for this answer. And I also think that maybe we should add the links to all of these organizations in the description of the talk. So let's take another question from the audience. Amira, go ahead.
Yeah, so first of all, like, don't kill me. I'm sorry if this was explained in the talk, because I was trying to make it for this talk that I drove from somewhere else. I was listening to it in the car, and now I'm home. But I guess my question is, given that a lot of these NGOs or institutes always start somewhere, and there are a lot of university students who want to play a much more active role in activism, and even though they lack the capital, they always want to start an organization, and oftentimes those organizations are purely aimed at like more awareness content without any actual like, you know, quantitative things in which like you have a medicine found or some cure or some malaria help. Like it doesn't fall into that category. Like, what would your advice be for these kinds of people? Like, do you think that it's worth doing that, or do you think that there's a different strategy that they should pick up on in terms of the kinds of operations that their NGOs run on?
Yeah, so that's a great question. I think I have a few thoughts on this. One is, in general, undoubtedly, it is important to start new charities, not only invest in ones that already have evidence for them. I mentioned this in kind of charity entrepreneurship, but what I didn't mention is that, for example, GiveWell themselves also provide what's called incubation grants, which is grants for organizations that don't have the evidence yet, but are doing interventions that have the potential to do this. So first of all, I think everyone would agree that this kind of evidence-based approach doesn't mean you always have to assume you have the evidence. It is definitely worth to do the exploration necessary. The second thing I want to say, though, is that I think pretty much everyone in the charity entrepreneurship space will say starting a new charity shouldn't be a goal in and of itself. It should come from a need that for some reason either can't be or isn't being addressed by additional organizations. Whether that organization is a government or existing established charities, usually you save a lot of overhead and hard work and risks of failure if you can manage to convince an existing organization to take on what you believe they should do. If, however, there are inherent reasons they won't do that, then you should consider opening a new charity with an intervention that is perhaps more effective than things that already exist. And then finally, I just want to say that indeed, I think the question of, let's say, exploration versus exploitation, how much you should explore new directions versus exploit your knowledge to be effective, is a complicated one. In many ways, I see the global health and development space as just within EA, the representative of the more kind of concretely evidence-based rather than the speculative directions. So I've focused on these areas. You'll hear a lot more in future lectures about extremely speculative interventions that we don't know how effective they are, but have the potential of being much more effective than the ones we're talking about here. So that's why this was my focus. I don't know if I can say, if I have something to say that's extremely intelligent about, you know, where you want to be on that explore, exploit spectrum. But I do think that being impact focused and evidence-based applies no matter where you are in that spectrum. And by that, I mean that founding new charities and exploring new interventions is absolutely great. But like I said before about like what I think were my mistakes in the beginning, I think even at that stage, you should say, okay, let's plan on how I check whether, you know, what I'm doing is effective and how I reach the point where I do have evidence, rather than kind of just saying, I want to explore, so, you know, evidence doesn't apply to me. I'll just do whatever I want.
Do you have tips for people that are looking to getting better at evaluation?
So I think for evaluation, what I would do is first read a lot of materials on the GiveWell blog. They have really great analyses that are pretty accessible. Also, the organizations that I mentioned, JPAL, SIGA, IPA, have blogs that they write. So that's kind of a pretty kind of lightweight to slowly learn more, which is a good way to recommend. But of course, if someone wants to, maybe I'll just say the top consideration is to say, find someone who will do it professionally. So I think in general, people should not be the ones evaluating their own efforts because they have a very strong interest in saying that it works. And so reach out to someone. A lot of the academic organizations, JPAL, SIGA, and so on, don't even need funding. They're happy to evaluate if it looks like a promising intervention. They're happy to evaluate. This is like their goal. And so reach out to an external organization and ask to be evaluated.
Thank you for the answer. Let's take another question from the audience. Sharmila?
This is quite related already to the stuff you said about narratives, right? We have very diverse donors globally, and you've mentioned some of the but I'd love to hear more actually about donor best practices that you've encountered. At the same time, what are some of the pitfalls that donors like sometimes fall into, and maybe how to avoid those?
Yeah, so that's a good question. So I think there are quite a few different mistakes that donors make. So one is calculating impact correctly. One version of this is counting counterfactual impact. So how much of what you're doing is crowding out other people and just you're kind of competing on being the one to give the money versus doing something that would not have happened without your funding. The classic example of this is when a company announces, we will match or we will do something with up to $10,000. Hurry up, because this usually runs out within 24 hours. When I see that, I see this is irrelevant to my decision because you're going to do this anyway. Unless, of course, there's a wide range of efficacy of the charities that they're willing to donate to. And maybe if I donate to an effective charity, that will use that funding in a way that's more effective than others. But this kind of counting is very important. It can lead to easily 2x, 4x, or in the negative side, 0x impact. And it gets pretty complicated pretty fast, unfortunately. So again, in GiveWell's analysis, you can see a lot of this kind of consideration. A second thing that I think donors often don't do sufficiently is, I think, well, this is a bit obvious, but I think don't look at the evidence and get excited by narratives too strongly. And I want to maybe in this context go back to, I think this was Amira's question on new things or speculative things. And another common question about this is also on things that are hard to measure, right? So, there's a lot of interventions that are just hard to measure. And so it's like we're saying that it's not good just because we don't know how to measure it. So I think there's definitely room for speculative donations and speculative investments, and you'll hear a lot more about them in future talks. But you are paying a very high price when you don't have evidence. When randomized controlled trials are run on social interventions that previously were not tested, more than 75% of them find no significant effect. So what this means is that you're taking a big risk. Now, if that risk means that you can now do something that has the potential to be 100 times more effective, that very well might be worth it. But if you're going to do something that is, there's no really good reason to believe is vastly more promising or more significant than interventions that do have evidence, then that is a very big risk to take for very little gain. And just to tie this back to the original question, just to mention, I think donors are very often extremely excited by saying, this is something completely new. It has never been tried before. It's, and I think it might be justified, but that in and of itself is a downside, not an upside for me.
Thank you for the answer. So let's take another question from the audience. There's more. Yeah, Dana, go ahead.
I know that you said that you don't want to choose people's values for them, but I was wondering if you have any answers to trying to convince, completely hypothetically, my father, that says that you need to prioritize your own poor, your immediate surrounding more than people abroad.
Yeah, so I think there are a few thoughts here. So one is, I think very few people stand behind that statement when it becomes concrete. I think often what people say is caring about their own country or their own community, is caring about what is socially acceptable in their country, or caring about the people that they actually know. When people meet someone from a different country that needs help, when people even see a Netflix documentary about someone who needs help, suddenly those people magically come into their circle of people that deserve their moral consideration. And so I think really kind of an observation of who they care about, why they care about them, and so on, is I think often can help with that. But I think the true solution is not, I think arguing with people about their values tends to be very unproductive. People don't tend to be persuaded. The two things that I think are more effective is, one, what I've done here as well, which is to say, here are the facts, choose whatever values you want. But a lot of people just don't know. They think, oh, maybe it's 10% more effective. So, I don't care about it that much, but they don't realize that we're talking about a 100 times multiplier. It's incomparable. And so for many people, that is enough. And then the second thing is having people be aware of the considerations, but not try to argue with them. That's another thing that I think in debate is very different from real life. In debate, we're kind of trained to say, let's now push you on, this is exactly where you're wrong, give me an answer now, and so on. That is not a great way to convince people in an informal setting. Rather, you want them to hear and continuously hear about different arguments, never challenge them on their opinions. You don't have to, never say, oh, you now have to decide whether you've switched to my side or you have not, which almost always people will not. But if you actually don't ask them, but if it's something that comes up every little while, then you'll find that 2-3 months later, they've changed their opinion. There was never a moment in which they've changed their opinion. Now it's obvious that these new value systems that match the people that they're now hanging out with happen to be the ones that they believe in. So, yeah.
Okay, thank you for the answer. Let's take another question from the audience. Yeah, Shams, go ahead.
I have so many questions, sorry. This one, so I'm just very curious, does the economics of drug production, well, the political economy of drug production and big pharma play a role in accessibility of testing and treatment, or is that overstated?
Yeah, so I think at least historically, there have been cases where changes in political economy have been incredibly important. And the name of the specific person who has done really important work in this currently eludes me. But there's at least one case of a person who went out to a lot of drug companies, said, look, right now you're selling this to 10% of the world's population, the drugs that you have. And at that price, and at that amount, you can't reduce costs because it's not cost effective. But here's a plan where you'll all together start selling to a lot of developing countries. You'll cut costs, you'll cut your prices significantly, but the increased amount will help. And he did some, I think there was a deal cut with the World Health Organization to try and fund this and so on. This created a huge difference. So I think that's an incredibly promising direction. It's not one that I'm an expert on. So, I don't know the details of like today is that, are there still opportunities on the table and things like that? But I've no doubt that at least as a general topic, it could be very important.
So let's take another one from the audience.
I have a last one.
Okay, we'll go Amira and then Shams. Amira, go ahead.
So I guess this is just in relation to the actual EA debating tournament that's happening. As a judge, and especially if you're on the edge core of the EA tournament, what is your biggest pet peeve that people say in debating in relation to motions that are specific about EA so that debaters won't say it during the tournament?
I think the thing that annoys me the most is when people mix up what is politically sexy with what is actually a large problem. The way in which most people, this is not specific to debaters, but the way in which most people evaluate how important a problem is how often they see it on their social media feeds, or how much they've seen people that they care about say like, oh my God, this is the most important thing ever. And that correlates very, very poorly with the question of how many people are actually affected by this and how severely. For example, every political issue in the United States is something that we, as people who I think everyone currently in the Zoom call doesn't live in the United States, care deeply about. And yet, there are, in India, for example, has about a third of the population with much more important and much more severe problems. And we just many of us don't even recognize them as significant and important problems. And there are policy problems and there are funding problems, there's a wide range of things. So that is the thing that annoys me most when someone says like, oh, this is the thing that the news is talking about right now. And clearly this is the most important thing that everyone should be working on. And yeah, so that's my answer.
Thank you for that answer. So Shalmela, go ahead.
This is my last question. So this emphasis on evidence and quantifying impact, some of the criticism here is that might it not lead then to risk aversion to organizations, like the unwillingness to experiment with approaches for fear that they will fail and then you will lose your funding, or unwillingness to engage with problems that are very, very complex, where I suppose the improvement is very long-term, if at all, like the space of civil rights or women's rights potentially, in terms of like more structural solutions. So is this a misguided criticism, or are there ways to deal with this within the community?
Yeah, so first I want to really separate between the talk that I just gave and effective altruism more broadly, because like I said, I kind of perceive the global health and development as the kind of the more evidence-based cause area within effective altruism. And so which again doesn't mean there aren't risky interventions within that space, but just kind of as I see this talk as making sure I protect the evidence-based directions, whereas other people will talk about other things. So that is not a good representative of effective altruism in general. when talking about effective altruism in general, I think early on the effective altruism community indeed did make that mistake. So effective altruism started from global health and development and GiveWell type interventions, and that was the vast majority of discourse and donations and work within effective altruism. And it indeed received a lot of this criticism, which I think was justified. That was true, I think, in 2011, 2012, arguably 2013. Since then, effective altruism has changed significantly for that consideration exactly, because of kind of lines of argumentation that say, not only is it possible that interventions with less evidence are more effective, but one could argue that the most effective interventions are by definition the ones with less evidence, because they're so risky that people don't want to take them, because things that are critically important, like sea changes in politics, like structural differences, like long-term effects, are inherently difficult to measure and evaluate. Nowadays, a majority of EA organizations, funding, and work goes actually to the speculative extreme of the spectrum. So I think relative to donors broadly, EA is much more speculative. So again, I'm defending kind of why evidence is important, and I still stand behind the statement that you should only leave evidence if you have really strong reasons to do so, but there are causes that I think have really strong reasons to do so. And finally, just to say, the last lecture in the series will be mainly about existential risks, which are risks for the totality of humanity dying, which by definition, we will never have the chance to look back and say, oh, that time this is what happened. And that is incredibly long-term, incredibly speculative, but it's something that is getting a lot of attention within effective altruism.
Okay, thank you for the answer. Do we have more questions from the audience? If so, raise your hand. Okay.
Managed to wear them down, finally.
Seems so. So one last question. So many people right now, because of the pandemic worldwide, may have some spare time on their hands or may looking into making big changes in their lives. So I assume if they're watching this content, they may, thread on, they're interested in EA and may want to start and read more. So if, for someone that has time or maybe some spare resources right now, how would you recommend engaging the subject? Or even specifically what you've talked about in this talk of introduction to health?
Yeah, so that's an excellent question. I think the first place I'd go to is effectivealtruism.org, which has kind of these introductory materials where you can read a bit more in depth and has links to a lot of other resources. It can be a bit tough to, these are complicated topics. It can be a bit tough to onboard on your own. In many countries, not all of them, but a lot of them, there are effective altruism communities where people are happy to kind of walk you through, send you relevant materials, hear what you're interested in, and send you things that are specifically relevant to that. So I would highly recommend, just if you're interested, searching effective altruism in the name of your country or the name of your city, and reaching out, and of course, competing in the Effective Altruism Debate Championship, which is a great jumping point for people interested in effective altruism.
Indeed it is. Okay, so we'll also try to add many of the links that Sella mentioned in the description of the talk and our Facebook pages. So thank you very much, Sella, for a very interesting chat, and thank you very much for everyone in the audience for all of your questions. Please subscribe to the channel if you would like this content, and thank you very much all. Again, highly appreciate it.